We're being joined online by Governor Mike Dunleavy. He is governor of Alaska, previously served as state senator for 5 years. Governor Dunleavy, thanks so much for joining the show. Really appreciate it.
Hey, Ben, it's great to be here. Thanks for having me.
So let's talk about what you are doing in your state to reopen. So you've issued some new orders that allow people to reopen. What exactly is the status in your state?
So we're going to what we refer to as phase one. We have 5 phases laid out, but phase one basically lets folks get back to getting into restaurants at 25% capacity. The restaurants will reconfigure their indoor dining so that families can come in, get reservations. Hairdressers, nail salons, spas, etc. A very similar situation in that they do a reservation. There's social distancing to some extent in terms of the configuration once again inside the establishments. But again, we're gonna ease in. We're gonna watch our numbers, and again, we're gonna have science drive this and data drive this, Ben, because our numbers are probably the lowest in the nation, and we've done a pretty good job up here. And so we have to also take into account the economy. That's the other part of the pandemic. That's the other disaster. And if we don't get it up running sooner than later, we're going to have some serious long-term issues. So we're easing into it. We think we're going to be fine. We'll watch the numbers. We'll watch our ICU bed count, our R-naught numbers, our infection rates. But I think we can do this.
So what does it look like in terms of face masks? There's been a lot of talk about face masks nationwide and locally. Is there an order in place that folks are supposed to wear face masks publicly, or is that more up to personal discretion?
Publicly, it's personal discretion. We highly recommend it when you go into a grocery store. We have not mandated it. We hope that the business owners are going to implement some of their own workplace rules, and I think they will. I think they'll do it because they want their businesses to be open. They want their businesses not to be known as a place where you can get sick or get an infection. So I think what you're going to see as a result of this is individuals and businesses stand up more than most people think. I'm often asked the question in interviews, what are you going to do to force this issue or make this happen? And as I've said to people in our press conferences, we don't force the people of Alaska. We don't force entities. We ask them to work with us. And when they work with us, we get the numbers that we've got. And we expect the businesses to do the same thing. In other words, they're going to want to have their product or service move. They're going to want to have customers. So they're going to want to make sure that they do the best they can to prevent a spread of the virus within their establishment.
We're speaking with Governor Mike Dunleavy of Alaska. So Governor Dunleavy, when it comes to local control, I know there's some questions about some of the orders in Alaska as far as what localities are and are not allowed to do. Is there sort of a baseline level of opening that you expect all localities to obey, or do local mayors get to make the decisions?
We work with our local mayors. It's a big, diverse state. It's interesting. Just like we're in a federalist system in the United States where you have states that we believe governance closest to the people is the best. And so we work with our mayors. We work with our local governing officials. And Alaska, again, is so diverse, Ben, that you'll have a situation where you may have one small town isolated hundreds of miles from the nearest road, no hospital, no health care. And they may want to open up slower because they want to be very careful. We'll work with them. Conversely speaking, you'll have other parts of the state that maybe the infection rate is very low or non-existent. They may want to open up some things at a pace with the state. That'll work as well. But we're going to work with everybody, individuals as well as entities and municipalities.
Governor Dunleavy, there's been a lot of focus nationally on testing and the ability to test. What does the situation look like as far as testing in Alaska? And what capacity for testing do you think is necessary in order for more and more broad reopenings to take place? My understanding is the testing was basically to prevent overwhelming of the healthcare system in case a hotspot emerges. But what is the status of testing in Alaska?
So we're trying to test more and more people like everyone else. We actually produce many of our own swabs here in Alaska. The swabs have been difficult to get nationwide and internationally because everybody wants them at this time. We're going to start the process of producing our own vessels, our own plastic vessels for the test. And we're working on reagents. If we can get more reagents here in Alaska, we can test more. We can help track more where this virus is. And I think what we're going to find, I'm no doctor, but I think what we're going to find, Ben, is that a lot of us have already been infected. A lot of us have already had this virus, but we just don't manifest it in an illness. And that's going to be important to know. Again, the testing is going to help, but we also have to keep in mind that we do know that vulnerable individuals with underlying health conditions and the elderly are more susceptible to the ravages of this virus. And so if we can work at helping them keep away from this virus as much as possible, test folks in our senior centers, test those workers, test our workers in our prisons, which we do, we can keep our numbers low. And again, what we're doing so far is working. We'll ramp up our testing. We get more reagents. We'll test even more. But we keep an eye on it. If there's a cluster or an outbreak in a locale, we'll go in there. We'll assess what's going on. We'll see how we can make sure that that doesn't happen again. But in terms of closing down the state, the whole state, we don't see a reason to do that. We'll deal with each locale on an individual basis, and I think it's going to work for Alaska.
Have you been able to ramp up what they call contact tracing, having people who are able to run down the number of people who have been contacted by somebody with COVID-19 after the tests have actually ramped up? That's been, of course, one of the recommendations that has been trotted out there is that states should not only have testing regimens capable of identifying the hotspots, but then enough people on payroll who can actually contact trace to make sure that they don't spread beyond the hotspot.
We've been actually doing the tracing and tracking early on. When we first got our case, our first case was a pilot for a cargo airline, because once again, Alaska at our international airport in Anchorage, we're on the flyways coming out of Asia and Europe. And so we were able to do that and start tracking early. And because our numbers are low, we haven't had to put a lot of people on the payroll for tracking, but we're going to start ramping that up, as well as the complete, I guess you would say, when I say tracking, and this is not a dystopian a nightmare where we're going to put people in a database and then track them later on. But for the purpose of this virus, we're going to ramp up more individuals that are going to be able to keep a database, just so we can find out what's happening and dig down deeper. But again, we've been doing this since the beginning. We'll just start ramping it up more and more.
It's been Governor Mike Dunleavy of Alaska. Governor Dunleavy, one of the main centers of danger has been nursing homes. This is true across the nation. What sort of measures are you taking in Alaska to protect vulnerable populations? Because obviously not every population is of similar vulnerability. If you're young and healthy, there's a very, very good shot that you will be fine, even if you get COVID-19. But if you are elderly, or if you have pre-existing conditions, that's obviously very different. How is Alaska treating differently situated groups?
So the folks in our institutions, such as our seniors in our senior care homes, we locked that down early because we knew that this is going to be a population that could be hit hard. We watched what happened in Seattle, and so we locked it down early. We test our folks there. We test folks that are going in there to work. We're limiting very much so the visitation into these institutions, including our prisons, including our hospitals, a psychiatric hospital, including the senior centers. And so we really haven't had an outbreak in any of those institutions. And we want to keep it that way. The other thing we have been, which is very different than other states, is we have about 150 to 200 communities that are many, many miles off a road. Some of our communities are hundreds of miles away from a road. Some are even 1,000 miles away from a road. And so they're isolated, they're small, they don't have great healthcare facilities. Some have no doctors, no hospitals. We want to make sure that the virus doesn't get into those communities. And so we're very careful in terms of travel, non-necessary travel going into some of our communities to make sure that doesn't happen. And like I said, so far, it appears to be working. We're under no illusion that we can stop the infection. We've always said we will get more and more cases. What we wanted to prevent was this, and this is important, not overwhelming our hospitals. So since we have not overwhelmed our hospitals, our ICU bed count capacity is about 45%, I should say right now. We believe that we have an opportunity here to revive this economy before the economy gets in more trouble.
One of the things that's been fascinating is to watch as the media attack governors who are moving toward reopening. Have you gotten a lot of flack from either local or national media for reopening? Obviously, you've seen that sort of flack applied to Brian Kemp in Georgia. You haven't seen it applied in nearly the same ways to Jared Polis in Colorado. Perhaps that has to do with political affiliation, or perhaps that has to do with the crowding of a state. Obviously, Atlanta is a major population center. Have you gotten any of the same sort of flack in Alaska for your moves towards reopening?
No, we haven't. We haven't yet because of our numbers and the fact that we actually follow science and data and we don't politicize it. Alaska, the other thing with Alaska is we've had a history of disasters in Alaska. I mean, we are used to disasters in Alaska. I hate to say that. Earthquakes, volcanic eruptions, floods, fires. It's a common occurrence up here. When this happens, all Alaskans pull together. There's no discussion about right or left, Republican, Democrat. Everyone works together when we're in a disaster in Alaska, and we work really well. And so the press has been focused on getting the news out to the people about our counts, how we're going to reopen the businesses, et cetera, et cetera. So, no, we've been spared that. with regard to governors like Governor Kemp, again, I tell people governors know their states better than anyone else. I can't tell Governor Kemp what to do or what he should do. He knows his state better than I do, and vice versa. We know our state up here better than most people. Again, that's the whole concept of states and federalism and local control. I think the governors are doing the best job they can. I think the president's doing the best job he can. Nobody wrote the handbook on this pandemic, as we know, Ben, and so we're going to get through this. It's just we're going to learn a lot from it.
Well, Governor Mike Dunleavy of Alaska, really appreciate your time, sir, and thanks for all you're doing for your state and moving in safe and responsible fashion toward reopening. Thanks so much for joining the show.
Thank you. Thank you very much.
I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.